Diabetes is a condition that infects the entire body in a number of ways. Similarly with the eye, it can affect the front part of the eye, making cataracts develop a little bit sooner than they would otherwise. And most importantly, it can affect the retina. It can cause damage to the blood vessels, which is responsible for bringing oxygen and nutrients to the retina. It can also make some of these blood vessels leaky, so they leak fluid, and that can cause blurred vision. There's a number of treatment options available for diabetic retinopathy, and it depends on how much the retina is affected by the disease process. When the blood vessels are leaky and there's fluid in the retina, sometimes we treat with laser, but we also have an array of injections that go into the eye to help dry up that fluid and improve the vision. There's a lot of new medications that are coming out, and we try to stay on top of those to deliver the best care for patients. Sometimes when diabetic retinopathy is quite advanced, it can lead to bleeding in the eye, and this can require surgery to clear out the blood, to clear out scar tissue as well, and sometimes to effect a retinal detachment or to repair a retinal detachment. Sickle cell retinopathy is a condition of the retina that is caused by a sickle cell blood disorder. This is basically where there are changes to the hemoglobin molecule, and so the red blood cells change their shape from a normally circular shape to kind of a sickle shape. This makes difficulty in having the red blood cells travel throughout the blood vessels and can sometimes cause a blockage in the blood vessels, leading to ischemia or a lack of blood flow, and can sometimes lead to bleeding that develops in the eye as well. Over time, scar tissue can develop that can limit the vision also. Treatments for this include sometimes laser, injections of medication, and rarely surgery. Bascom Palmer Eye Institute, centered in Miami, has patients from a broad number of areas, including South Florida, the Caribbean, Central and South America as well. And therefore, we have a number of patients with sickle cell blood disorders. And so we have a lot of experience taking care of these patients, and that helps us provide the maximum visual benefit to these patients.